I'd like to talk to you about multimodality imaging of the pericardium, a new imaging-guided approach to pericardial disease. So what is pericardial disease? It's a disease of the skin of the heart, and it causes acute pericarditis, recurrent pericarditis, constrictive pericarditis, and we have a new approach how to image the heart and to guide therapy. The images that we're talking about is advanced imaging, including echocardiography, strain imaging, CMR, and CT scanning. So right now with these diseases, by looking at the images, we can estimate the prognosis of the patient and guide therapy. For example, if you have an MRI showing a lot of edema around the heart or inflammation, this will prognosticate that it will take up to 3 to 4 years of giving this patient anti-inflammatory medicine. So we have a newer way to guide therapy. Similarly, if there is constrictive physiology on the echocardiogram, this also portends a poor prognosis. We have done many studies with CMR and echocardiography, and now we have a good way to quantify how much inflammation is around the heart. What we do is we inject a gadolinium on an MRI, and usually the gadolinium doesn't get into the pericardium, but with an inflamed pericardium, as in pericarditis, it does get into the pericardium, and the brighter it is, will prognosticate how bad it is. So we see patients anywhere from a teenager to 50 years old. They may get a viral illness, and they come to the Cleveland Clinic, and we help diagnose the condition, and we get them on therapy. What is the therapy for this disease? It's often anti-inflammatories. The anti-inflammatories include NSAIDs such as ibuprofen, colchicine, and occasionally we use steroids. Sometimes we give all three drugs. If that doesn't work, then we go to a fourth drug called a DMARD. Includes drugs like azathioprine. And if that doesn't work, we go to a new drug called a biologic. The drug is called anakinra, which is an interleukin receptor blocker, and this seems to be very promising for this disease. If that doesn't work, then we often refer the patient to a surgeon for pericardiectomy. So what I'm proposing at a Pericardial Center of Excellence is that we have a new imaging-guided approach to help diagnose, prognosticate, and treat these patients.
GenWorks is here. Together, let's work towards a healthier India.